I'd like to acknowledge that I'm recording this presentation on the lands of the Whadjuk Noongar people and wish to pay my respects to elders past, present and emerging. And I'd like to extend this acknowledgement to the elders of the lands that you're watching this presentation from. I'll start by introducing myself and the research. My name is Jessica Keeley and I'm a PhD candidate at Curtin University in Western Australia. I am a white Australian woman, and my interest in research about the factors that affect people with an intellectual disability stems from my experience of having a cousin with Down syndrome. I hold a social constructionist epistemological position and conduct my research through a critical disability theory lens. The research that I'll be referring to in this presentation is a Foucauldian discourse analysis on how the Australian news media constructs people with an intellectual disability within the context of psychotropic medications. And this research was part of my honours project. I'm currently in the process of conducting a Foucauldian discourse analysis on how the Australian news media constructs people with an intellectual disability within the context of familial maltreatment. And this forms part of my PhD. I was hoping to be a bit further along in this study so that I could also use it as an example in this presentation, but this has not been possible. However, the content of this presentation is influenced by the reflections and additional research conducted in preparation for this second media analysis. I'd quickly like to touch on some of the language that I'm going to use throughout this presentation. So I will use person first language to refer to people ascribed to this label as people with an intellectual disability. And while labels can be arbitrary and harmful as well as not identified with, this term reflects the current vernacular in Australia and is necessary for identification purposes within this context. Psychotropic medications will also be discussed, and these can also be referred to as neuroleptics. And examples include antidepressants, antipsychotics, sedatives, and anti-anxiety agents. I will also refer to behaviours of concern, which are also known as challenging behaviours. These are behaviours that are thought to threaten the safety of the individual exhibiting them, but also the people around them. And some common examples include aggression and inappropriate sexual behaviour. Foucauldian discourse analysis is an increasingly popular form of qualitative inquiry that attends to discourse and its role in creating and reinforcing social norms and power differentials. It was originally developed in the 1970s and is informed by the philosophies of Michel Foucault and other post-structuralists. According to Foucault, discourse is a system of meaning through which the essence of a phenomenon is created and understood. Discourse encompasses a wide range of interactions, including but not exclusively talk, text, cartoons, dance, and news articles. The media has been shown to reveal socially dominant discourses and is therefore a beneficial resource for understanding the construction of phenomena. And social perspectives provide a useful framework for understanding power relations within society. The media can be influential in perpetuating stigma in its coverage of many marginalised groups, including people with disabilities. The media tends to present people with disabilities as different or other, display inaccurate representations, and or ignore issues relating to the experience of disability. There are guidelines available to conduct a Foucauldian discourse analysis, such as those outlined by Willig and Riley and Wiggins. However, because of the broad nature of discourses, these are and need to be somewhat ambiguous. These guidelines tend to refer to interview data. However, Foucauldian discourse analysis is also well suited to media data. One of the challenges of conducting a Foucauldian discourse analysis is that these broad guidelines need to be further interpreted to apply to media data. Another challenge is that the depth of analysis requires a substantial amount of time. There is also many different Foucauldian concepts and philosophies that can be used and applied in the analysis and writing of the report, and it can be challenging to know if and how these should be incorporated. There is also a challenge in writing a report that is not too thematic in nature. So I'm now going to present my research, and I'll start by presenting the findings, and then I will go back and cover how I conducted the study. So 3 discourses were found. The first discourse, a discredited and erased voice, refers to the voices of people with an intellectual disability being undermined and largely absent from the psychotropic medication narrative. So the experiences of people with an intellectual disability were largely omitted. This is in contrast to the almost exclusive representation of perspectives of people without an intellectual disability, so family members and support workers. This disparity is problematic because it suggests that the perspectives of people without an intellectual disability are valuable, newsworthy, and relevant, while the perspectives of people with an intellectual disability are not. It also implies that people with an intellectual disability cannot speak for themselves. Also, language was used that discredited and undermined people with an intellectual disability within the context of psychotropic medications. So, for example, in one article, someone with an intellectual disability is described as having the mental age of a young child. Infantilizing language such as this is disempowering as it undermines the individual's experience. The discourse disability as difference and potentially dangerous refers to the positioning of people with an intellectual disability as different and dangerous. This was achieved by describing people with an intellectual disability as outside of the norm and fundamentally different to people not ascribed this label. Several articles referred to an increase in psychotropic medication prescriptions for children generally and used people with autism as a comparison group. This is an example of ableism, a perception that being without a disability is the norm. People with autism were also portrayed as different to people without this label through the discussion of behaviours of concern. Narratives were employed that proposed that behaviours of concern are exclusive and inherent to people with autism, and that autism itself requires medication. Murder was also associated with people with autism when authors repeatedly referred to the accused murderer's diagnosis in relation to their behaviour. The third discourse is justification and victimhood and has 2 sub-discourses. The justification of the use of psychotropic medications for people with an intellectual disability appeared to be contingent on whether or not the person with an intellectual disability was framed as a victim or as the burden. The first sub-discourse, justifiable, the burden of disability, describes how psychotropic medications were framed as justifiable when people around the individual with an intellectual disability, so family and parents, were positioned as the victim. One article reported on the deaths of an elderly couple who gave their son Matthew, who was described as having an intellectual disability and being blind, a sedative before they killed him. The couple's motivation to kill Matthew was reportedly to end his suffering. However, the experience of Matthew's suffering was not mentioned, suggesting that his disability was sufficient explanation. On the other hand, the parents' experience of suffering was discussed and emphasised throughout the article. The parents' experience of burden appears to be used to justify Matthew's death, implying that the parents' experience was valued not only above Matthew's experience, but also his life. Articles generally displayed this notion that the rights of people without an intellectual disability superseded the rights of people with an intellectual disability. In contrast, the sub-discourse unjustifiable vulnerable victims suggests that the use of psychotropic medications is unjustifiable when people with an intellectual disability were positioned as victims. People with a disability were often framed as powerless, one-dimensional, helpless, passive, and vulnerable victims within the psychotropic medication narrative. For example, in one article describing institutional abuse, including inappropriate use of psychotropic medications, people with an intellectual disability were described as the most vulnerable people in the community. And as a result, psychotropic medications were framed as inappropriate and unjustifiable. Negative stereotypes, such as emphasizing vulnerability, is limiting and harmful to people with an intellectual disability, as it restricts how people ascribed to this label can participate in society and inaccurately implies that people without an intellectual disability are invulnerable by comparison. So I'll take a step back now and describe my research process. Relevant Australian news articles published between 2013 and 2019 that were available through Factiva and ProQuest databases were included in the study. Search terms included different iterations of intellectual disability and psychotropic medications. People with autism were included in the search, as autism is often confounded with intellectual disability. However, articles were excluded if it was clear that the individual did not also have an intellectual disability. The final sample comprised 129 articles. Now I will describe how I applied Foucauldian discourse analysis to the media data collected. This analysis was informed by Willig's guidelines for conducting a Foucauldian discourse analysis, which comprises 6 stages. I also draw from Foucauldian discourse analysis commentary presented by Owens. I've presented several examples, but I'll only discuss the first highlighted example. Stage 1 is discursive constructions, which looks at the object being constructed. For example, people with an intellectual disability were constructed as burdens on their family. Stage 2 is discourses and is attentive to the types of discourses that are used. So, for example, people with an intellectual disability were described within a tragedy discourse. Stage 3 is action orientation, which addresses the consequences of discussing a particular object using a particular discourse. So, for example, using a tragedy discourse can result in the families of people with an intellectual disability being constructed as heroic in the face of the described burden of caring for people with an intellectual disability. We move on now to the next 3 stages of analysis, and you'll see that the focus shifts from the object to the subject position. Stage 4 is positionings and looks at the subject position constructed. For example, people with an intellectual disability were constructed as one-dimensional, passive burdens on their family, and their families were positioned as heroes. Stage 5 is practice and addresses what can be said and done when an individual is constructed as a particular subject position. So, for example, when families are constructed as heroic, they can make decisions about psychotropic medications for people with an intellectual disability based on what's right for the family, but not necessarily what's right for the person with an intellectual disability. Stage 6 is subjectivity and looks at the emotions available to the individual or group when they are constructed as a particular subject position. So, for example, families can feel in control and that the use of psychotropic medications is justifiable as a result of the burden. However, people with an intellectual disability are not really afforded any emotions or complexity within this context. So as you can see, each of the stages is influenced and influences the other stages. There are many ways that you could go about the coding process. However, what I did was insert the article into the middle of 3 columns in a Word document. I coded each article 1 stage at a time in sequential order, and the stages were color-coded so that they were easily identifiable. Preliminary discourses were identified through the evaluation and observation of emerging patterns. And I placed examples of these emerging patterns in tables with ever-evolving descriptions or summaries of what these patterns were revealing. Through this process, discourses became more concrete and were then further defined. Thank you for watching this presentation, and if you have any comments or questions, please email me.